Good morning, Doc.
Hey, morning, guys. Can you hear me okay?
We got you. Yep, coming in loud and clear.
All right.
Morning, morning. So, the meeting last night was there any the physician advisory group meeting last night? Was there discussion on schools? Was that a subject that you guys touched on?
Sorry, could you say that again?
Schools, reopening of schools. Was that discussed last night?
Oh, yeah, I asked about that. But no, there wasn't anything yet. I've only heard what was in the news with DOE maybe thinking of January as a start date. I was asking, see if anybody heard anything from Dodea.
Right.
They've been open for quite some time now. I haven't heard any news, and in this case, no news seems to be good news. So they seem to be doing something right, but nobody on the PAG, and I don't have a contact out there.
Right. Yeah.
Shed any light on that, but seems promising. And looking at the news with I think it was Mr. Fernandez saying maybe January as a start date seems now pretty possible. Hopefully, we did discuss. Between what you have with Dr. Lombard and Lillian, you guys, I don't even know if you guys need me. You guys kind of covered all the topics. But yeah, Guam's doing really well. I think our CAR score's been under 5 for 4 going on 5 days now. And the meeting was just kind of discussing that with kind of a little wariness looking, across the ocean to stateside, which is now suddenly caught on fire. So
Right.
Guam in perspective or relatively is looking much better.
Right.
So nothing, no discussion. Well, I'd like to hear what you have to say about the quarantine. The CDC rolled out those new guidelines, shortening the amount of time.
We discussed it, but there's no new recommendations that were set yesterday. The guidelines just came out, and ultimately CDC offers guidance, but it'll be up to public health that determines what the actual rules are for Guam. But yeah, we were talking about ways that maybe we could make it a little bit more logistically simple for travelers come back to Guam. But the other really great point was brought up at the patio that we don't want to relax it too early, especially if most of our travelers are going to be coming from stateside. So then we're going to release people early, and now we might be releasing people who might later end up turning positive.
Right.
So that's the one thing we can't close our borders, right?
Right. Yeah.
Yeah.
That's interesting.
Yeah.
I was thinking last night about how long it took us, and assuming that's what's happening, how long it took us to wind down from the huge second surge that we're now starting to see, lower number of positives. And so I feel like, and this is something we've been saying all week, I feel like the talk about the CAR score lowering and the easing of restrictions, I just pray that it doesn't let people let their guard down too early, because I really would hate to see another surge. It took us months to get to where we're at now to even be at this place where we can talk about potentially reopening, right?
I agree. I think, it's a mix of a lot of things. Definitely we have new therapeutics. You guys were talking about the monoclonal antibodies. And people are definitely way more, cognizant of, the fact that it's going around. But the other thing I've noticed, just completely anecdotally in my clinic when we're testing patients and testing and the people that want to come in and get tested, when I ask them if they're wearing masks at work or with their exposure, I almost like 90% of the people now are telling me like, oh yeah, I was exposed, but yeah, I was definitely wearing a mask the whole time. And a lot of them are turned out negative. So I wonder, people are they're saying that the mobility data hasn't changed. We didn't really talk about that yesterday, but if that's the case, then the other thing that might have changed is people are just much better about wearing masks and keeping their distance, once they get to their destination, I suppose. One thing that I thought was interesting, I know you talked about the monoclonal antibodies. I was asking if at GRMC if, they were just, all their slots were full every day, and surprisingly not. So I don't know if this is a matter of, people, their doctors aren't aware, people aren't aware, or what's very possible is that some insurance companies are requiring a prior authorization, which kind of delays the ability for people to get in. But what I've heard was that if somebody has Medicare, Medicaid, MIP, or Aetna insurance, they don't require prior authorization. So if any patients with those insurances get COVID, have mild symptoms, have a comorbidity of obesity, you would totally qualify for this. And this is something that we want people to get in within 10 days of having symptoms, because this is an outpatient thing to keep them out of the hospital, right? So this is something we really want people to take advantage of, especially if the government's providing it for essentially free.
You know, Dr. Ho was on and he talked about a kind of a winding down at the clinic level. Are you seeing the same thing at One Love Pediatrics?
Yeah, I get what I've been seeing for the past couple months now is that mostly people, when they're kind of sick, I've noticed that they haven't been coming in with the same frequency. And I don't know if it's, they are just kind of hoping it's, it's just one kid that's sick. We don't think it's COVID. We don't want to know if it's COVID. Or if it's, or the other thing is a lot of daycares weren't quite open yet, because that's a really easy way for kids to transmit. So mostly I've been seeing, by and large, a lot of well child visits and just kind of catching up with the annual checkups.
Right.
And when I see them, even the kids now are just really good about wearing the masks, which is so interesting, and just shows like how easily kids can adapt to new circumstances.
You brought up daycare. Did you guys discuss what happened over at Mercy Heights?
Very, very briefly, and really just tangentially, just that the staff had it, and I don't think any of the kids got it. I think they might be set to be opening up soon, but that wasn't really anything we had in deep discussion. I think maybe one or two of the PAG members were saying like, "Oh, my kid goes there, and I'm happy to send my kid back once they open up." So, there's a lot of faith in the process right now.
Okay.
So
we need a connected Dodea.
Yeah, that would be helpful. Just so we could get, see how they were doing and challenges that they had. But this might be a moot point until maybe January. Yeah, I'm not sure. I'm sure the schools, all the other schools, are all really busy getting prepared for that. If that's really the case, they're going to open up then.
All right.
No, that's
Thanks,
it.
Doc.
Yeah, you're right. Anything else you want to throw out here, Doc?
That's it. So far we're doing a great job, and I think it's a lot of personal behaviors that are really contributing to that. In addition to all the new testing ability and the new modalities for treatment. So, we're in a really good place right now. We just don't want this to blow up and have us look like stateside.
Man,
Yeah.
I feel you.
So please, everybody, keep up and doing good work.
All right. Happy holidays.
Happy holidays, Doc. Thank you.
All right. Happy holidays, guys. Thanks.
See you. There you go. 8:57. We got to take a break, and we'll come back with more of the show. It's The Link on the Breeze. We're KUAM FM in Agatna, Guam, but really we're actually in Harmon. It's Friday, December 4th episode of The Link, brought to you by Cabo Select Care, federal employees and annuitants. It's 2020 federal benefits open season. Enroll now until December 14, 2020. Call 477-9808 for more info. They're